When does coinsurance apply to my medical bills? Have you ever wondered when coinsurance comes into play with your medical bills? Coinsurance is a cost-sharing method used in health insurance. It means you pay a certain percentage of the cost for covered medical services after you have met your deductible. This typically applies to various medical bills, such as hospital stays, outpatient services, and doctor visits, depending on your specific insurance plan. To understand how coinsurance works, let's break it down. First, you need to meet your deductible. This is a fixed dollar amount you must pay out of pocket before your insurance starts to share costs. Once you have paid your deductible, coinsurance kicks in. For example, if your plan has a 20% coinsurance, you would pay 20% of the allowed amount for covered services, while your insurer pays the remaining 80%. Coinsurance often applies to different types of services. This includes hospital stays, outpatient procedures, specialist visits, and certain therapies. For instance, Medicare Part B covers many outpatient services and requires you to pay 20% coinsurance after meeting your deductible. However, mental health outpatient services under Medicare may have a different coinsurance rate, such as 50%. When it comes to hospital care, coinsurance works a bit differently under Medicare Part A. After you pay the initial deductible for inpatient stays, coinsurance applies. For example, Medicare Part A requires you to pay a deductible for the first 60 days of a hospital stay. After that, coinsurance applies from days 61 to 90, which could be for $108 per day in 2025. A higher coinsurance rate may apply beyond 90 days. It's important to note the difference between coinsurance and copayments. A copayment is a fixed amount you pay for a service, while coinsurance is a percentage of the total cost. This means your out-of-pocket expenses can vary based on the total charges for the service. Coinsurance does not apply to services or supplies that your insurance plan does not cover. You are responsible for the full cost of any non-covered services. Additionally, some preventive services may be covered without any coinsurance or deductible under many plans. To manage your expenses effectively, always check your insurance plan details. Understand your deductible, coinsurance percentage, and which services are subject to coinsurance. Be aware that coinsurance can lead to significant out-of-pocket costs, especially for expensive procedures or extended hospital stays. Some plans also have out-of-pocket maximums, which cap the total amount you pay in deductibles, coinsurance, and copayments annually. In summary, coinsurance applies to your medical bills after you meet your deductible. It generally involves paying a percentage of the allowed cost for covered services. Knowing when and how coinsurance applies can help you anticipate your potential costs and manage your healthcare expenses better.